The other thing I would say is you have to have these conversations because healthcare is a lot more personal than it is ideological. We've allowed ourselves by the media, which focuses on conflict and not resolution, we've allowed them to trap us as Democrats versus Republicans and Republicans versus Democrats, and we hate them and they hate us, and we've allowed ourselves to be divided in much the same way that our healthcare funding and delivery system is divided. The term Walter didn't use tonight, but I think is a very powerful term, probably best capturing our system today is what he calls, and others have called, medical apartheid. We have been separated along economic lines, along demographic lines, you name it, we have been divided against each other. And that's precisely the way that the folks who are running all the way to the bank and taking our dollars and losing them on Wall Street and then passing the losses on to us in the form of higher premiums, that's the way they want it. It's called no-risk capitalism. They love it. One thing else about the healthcare system here in Pennsylvania is that the Blues, right? Everybody's familiar with the Blues. Now, on the surface, right, they're non-profit, right? Good company. I listen to the Phillies games, IBC, they're there with us every step of the way. Highmark, Northeast, Capital, really, really caring, deep, deep caring health insurance companies. The four Blues, the four Blue Cross consortiums in Pennsylvania control how much of the market?
95.
Close. 86% of the market. I think Economics 101 will tell you that's a monopoly. And their charge, when they were set up over the last 50 years, their charge was to be nonprofit and put patient interests and healing first. Well, they've done anything but that over the last 50 years. It's been a downward trend over the last 50 years. And this industry is broke. This industry is an absolute absurdity. It's an absolute sham on our society. The industry operates by a for-profit model. Even though they're non-profit, they charge the same premiums as Aetna and Cigna and all the other private for-profits. But rather than taking those monies that they make and paying them out to stockholders and investors and such, where do the monies go?
Bonuses for executives. Bonuses for executives.
Bonuses for executives. Marketing, yeah, marketing costs, tremendous, right? I mean, hospitals, yes, but lobbying,
Buses.
bringing the teabaggers into Pennsylvania, buying real estate,
Fancy offices over
yeah, huge buildings, huge skyscrapers. You should make your way out to Pittsburgh if you haven't recently and see what wonderful architecture Highmark has created with our premium dollars and the dollars they've denied us in terms of healthcare payment. But it's a market that is 86% blue. And it's a market that has been enabled by politicians. And why do the politicians enable them? Because they enable the politicians, right? And here's the dirty little secret. Some of you know this. You've talked about economics around healthcare. The major portion of the money that they raise and don't pay out in healthcare or to trustees, do you know how much money that is? That's now set aside, so-called surpluses? Billions. $18 billion is sitting in 4 separate bank accounts across the state of Pennsylvania. Money that's not going into healthcare delivery. That's a curious thing, isn't it? That's, if you're a subscriber to any of the Blues, and I work at University of the Arts, and we just got hit with a 14% premium hit, and we just got hit with a 50% copay hit for meds. I have glaucoma, I have to feed my eyes 6 times a day. I spend now $240 out of pocket on top of my benefits, right? This is what's going on. They're passing on their losses to us. And they have no incentives whatsoever to control what Walter described up at the top as waste, fraud, abuse, excess CEO salaries, marketing, reckless Wall Street investments, and healthcare cost denials. We can and will take them down. And the reason that we can and will take them down is you will not find a politician publicly defending them any longer. 10 years ago, we couldn't have really had this conversation. But this is these once every half generation or full generation events, right? Like Halley's Comet. It comes along every 20, 25 years. And we better be ready to win this time, because if we don't, we're going to lose not just our economy, not just our healthcare system, not hundreds of millions of Americans who are directly at risk of catastrophic loss, and the 50 million who are uninsured and the 50 million more who are underinsured. Not just those numbers, not just our future, not just our economy, but fundamentally our democracy. Because what we've done here is we've created an economic system around healthcare that is being replicated by other corporations in our society. It's called welfare capitalism. And Benito Mussolini had a very clever name for it back in the early 1920s. He created an economic system. People familiar with that one? You've heard of Benito Mussolini, right? State corporatism, I think, is a term he used, but it's economic fascism. And that literally is what we have right now. I have my students read a book called Free Lunch. David K. Johnson with the New York Times, an economist. He's written the way that our economy is flipped upside down. That more than 85% of the wealth accumulated by the top 20% in our society has been taxpayer dollars over the last 30 years. They're not actually generating new wealth. They're actually reaching deeper and deeper and deeper into our pockets. We have an amazing opportunity here in Pennsylvania because we've got advantages that other states don't. And this is the political reality of Pennsylvania. And I've testified before 3 Republican caucuses and before 3 Democratic caucuses and had to fight to get in each one of those presentations. But the word's out. And the leadership on both sides is actually freaked out about us. They're freaked out because Healthcare for All Pennsylvania, this is the first building block. We are a huge grassroots movement. We represent a statewide movement that hasn't existed in this state for decades. Decades. Yet you're not going to hear about us because the mainstream media doesn't like to talk about resolution. They're more interested in listening to Democratic leaders and Republican leaders and conflict. But actually resolving our healthcare system, that's not going to hit the mainstream media. You have to go to blogs. You have to talk to each other. We're more than 10,000 Pennsylvanians have signed up with Healthcare for All Pennsylvania. We now have 27 chapters across the state of Pennsylvania. We've got a stronger grassroots organization that's never been heard of than most anywhere else in the United States.